I was taking a multivitamin, but my needs changed. I wanted support from my heart, and now I get it from Centrum Specialist Heart.
New Centrum Specialist Vision helps keep my eyes healthy.
Centrum Specialist Energy helps me keep up with them.
Centrum Specialist Prenatal supports my child's growth and development.
New Centrum Specialist is a complete multivitamin that gives me all the benefits of Centrum.
Plus additional support
for what's important to me. New Centrum Specialist helps make nutrition possible.
Community pharmacists are actually uniquely positioned within the U.S. healthcare system to take on a more prominent role within the healthcare delivery model. And that goes beyond their traditional role of dispensing medications and administering vaccines to becoming more of a patient educator. Technology facilitates that. It's extremely difficult to deploy on a grand scale. An effort to enable pharmacists and patients to have that kind of an interaction without the support of technology. And what kind of technology would it be? It would cover a variety of technologies. For example, social media, mobile apps, traditional web-based tools are all going to play into it. So there will be, a tremendous amount of import placed on technology in order to support the pharmacist's role within the emerging healthcare paradigm. I think, the incorporation of tablets into the delivery model is absolutely, one of the more preeminent innovations, that's come along. It certainly facilitates a conversation the pharmacist might have with a patient, whether it's behind the counter or out in front talking about OTC remedies. If you look at it from a more practical sense, too, on the clinical delivery, of the components that are supported by the technology, that patient outcomes are dramatically driven upward, with respect to more technology. And if we're looking at an executable, broadly deployable model, that it has to have technology behind it. So, and whatever mechanism, that technology assumes or architecture, whether it's a tablet or some other means, it's absolutely critical. That's why the technology is such an important component, in healthcare today and as we move forward. I'm absolutely an optimist with respect to pharmacy opportunities in 2012 and beyond. Especially if we look in terms of what's been occurring both at the state level and federally with respect to healthcare reform, that in my view, it actually provides an opportunity for pharmacists to assume a more important role within the delivery model. So, and it's popular for us to talk in terms of healthcare reform in terms of how we pay for it prospectively. But rather than that, I suggest that what we need to be focusing on is how we actually contain costs, improve patient access and the quality of care through the implementation of various technologies that facilitate those three elements. The Affordable Care Act has numerous elements included in it, including accountable care organizations. And in my view, pharmacies can actually play an extremely important role there to mitigate patient readmissions, by participating in the accountable care organizations and through other mechanisms too, that all drive the improvement of patient outcomes.